Yeah. So I know that you guys are bombarded with so much information. I'm being sitting for this workshop from morning, so I won't be taking much time. As a speech language pathologist, I would like to talk about the importance of voice therapy, especially for hyperfunctional voice disorder. So to introduce myself, I'm Dr. Irfana. I was working in NSCB for a few years. Presently, I'm working as assistant professor in Aish, Mysore. So coming to voice therapy as such, as a SLP, we usually work with respect to strengthening and structure and functions of entire larynx and the functions of larynx. So whatever weakness is there, so we try to strengthen the muscles. So that is what the aim of our voice therapy. Along with that, we usually work on self-awareness. Through self-awareness, we create awareness regarding the voice protection and introduce them how to take care of their voice or regarding the vocal hygiene. All those things we usually counsel in the sessions. And activities to improve their life, activities and participation. For example, if it is especially with respect to professional voice users, so with respect to their profession, like singers, teachers, so how do they have to use their voice for their profession and how they have to work otherwise? For example, when they're teaching in a classroom, how they have to use their voice. If they are not teaching, otherwise when they are sitting at home or they are talking to others, how they have to use. So with respect to all those things, we usually counsel these patients and modify contextual factors like environmental factors regarding water intake, pollution and other food intake. Regarding all those things, we usually deal with patients whenever they're having these kind of issues. With respect to assessment, we go through so many assessment procedure with including subjective and objective evaluations. And one of the previous presentation have seen that they have along the stroboscopy they have used doctor speech. That is one kind of objective analysis. So in whenever you are going through this case report, you can see all these terminologies. So I hope all of you are aware about it. If you're having any doubt, you can ask me. So we go for a self-assessment. Self-assessment there, the patient have to assess by themselves. They have to tell us what they are feeling about their voice. If they feel that there is a huge change happened since few years or few months, then it will be considered as a severe condition. So they have to tell us what is their identification regarding their own problem. So that's what we deal in self-assessment. So there are different methods. So voice handicapped index, as you can see in the first point. So that is the one commonly used across world. It is like a checklist. It is there in Hindi and most of the Indian regional languages. So they can read it, what they can understand what are the questions and they can answer for that question like a yes or no. For example, do you have pain while speaking? So there are questions like that. So they can just say yes or no. If it is present, they can just put yes. So based on the entire checklist, you will understand what is the severity of the problem, what they are rating by themselves. So that is what we deal usually in self-assessment. Coming to perceptual judgment, perceptual evaluation we usually do as hearing. When the patient is speaking, you can ask the patient to speak continuously. So we usually take a continuous speech. Along with that, we can ask for phonation. Phonation, like you can ask the patient to say E as much as possible or O. So these are the two phonemes we usually ask for. So based on the perceptual evaluation, what you feel it, what are the problems you identify? Is there any hoarseness or harshness present or breathiness? Breathiness meaning when they are speaking, there is a air leakage. Usually we all know that if there is a nodule, there will be air leakage. So if there is no proper closure of vocal cord, there will be air leakage while speaking. So that is what we call it as breathiness. So hoarseness is a common perceptual measure we usually can see in hyperfunctional voice disorder. Along with that, other condition like pitch variability, like a diplophonia can be seen, or other resonance issues. So based on perceptual evaluation, also you can find out if there is any difficulty for the patient. Along with this, we can go for acoustic analysis. There are many different kind of instruments available in the market. Whatever instrument you are using, you can go for some of these measures, whatever I have written here, like sound pressure level, which basically will give you information about the loudness of a person's speech, or loudness of a person's phonation, or the fundamental frequency of the voice, or harmonic noise ratio. Harmonic noise ratio usually will give information about the number of useful phonation in the presence of noise. So it should be more of harmonics than the noise component. If there is any structural deficit, or there is any vocal cord lesion or any growth on the vocal cord, there will be more of noise component. So in that case, noise component will be more than the harmonic component. So it usually seen in the case of abnormal conditions. Along with that, you can go for visual inspection, as we all do it in a case of stroboscopy. These are the few parameters we usually see. What is the glottal closure? Is it present, or is it incomplete, or is there any complete closure as such? And if there is any lesion present, and if there is any lesion, what is the size of lesion and degree of supraglottic constriction, amplitude and mucosal wave present or absent, and periodicity of mucosal wave and symmetry of vocal cords. These are the few parameters we usually see in a clinical population, in daily clinics also, and for the research purpose, we usually take these parameters. Along with that, we can go for aerodynamic measure using AeroView or spirometer. So you can go find out Sahasra ratio, or means airflow for maximum sustained phonation, or even for the comfortable sustained phonation. You can measure all these measures to find out what is the ability of the patients with respect to their subglottal pressure. Along with that, you can see like the EGG. We have it in NSEB also, ENT department also we have EGG. So that also can be used to understand the condition of vocal cords closure. So these are the few measures what we usually do. Now I would like to explain about some of the treatment method, and this is one of the main area I want to focus. So it's, though we are SLPs and ENT different profession as such, we always, it is better to work together in hand for the betterment of the patient. So there are studies showing that there is a requirement to have surgical method along with the voice therapy. So which are the voice therapy showing it is useful for the clinical population? That what I would like to show it based on few of the studies. So one of first study here, you can see that they have measured the quality of measures, quality of voice and quality of life measures, and along with that stroboscopic evaluation and voice range profile they have measured, where there were three groups for the study. First group was only medical treatment they have given. Second one, only voice hygiene they have given along with the accent method. That is one type of treatment method. Then the third one, there is a retrospective medical treatment. So it was not presently they were giving, it was whatever given priorly they had taken from the files. So there was no significant difference they could find between these groups as such, though one group was only have gone for medical treatment. So there was not much difference, and both medical treatment and vocal hygiene advice have positive effect in the sense both of them had a betterment of voice after a period of time, but there was no significant difference between these two groups. First two group there was no significant difference, but they improved compared to the pre-condition. Second study, it is basically with respect to vocal nodule. All are women participants, and they have measured based on perceptual evaluation and the mean SPL, fundamental frequency and perceptual evaluation. Here they have used behavioral voice therapy, and within behavioral voice therapy they had 5 phases, including vocal hygiene, direct facilitation, respiration, relaxation and carryover. So based on this study, based on going through all these 5 phases, they identified that there is a decreased nodule size and improved voice quality, that suggesting that voice therapy was effective, positively affecting for these individuals who have had bilateral vocal nodules. And there was a significant effect of therapy and it was seen for all these parameters like overall dysphonia, press, instability of pitch, grating, roughness, vocal fry, and scrape. All those measures will come under the perceptual evaluation. All those things show that there is a significant improvement in the post therapy compared to the pre therapy. Another group, again, it was a vocal nodule, vocal fold nodule cases. There were three group for treatment. First one was voice therapy. Second one, surgery plus therapy. There was no consensus between the surgeon and the voice therapy SLP. But in the third group, there is an integrated method, whereas otolaryngologists and SLPs were working in hand. As you can see here, there was a more than 50% improvement seen in the third group. So that is what my major aim of showing you this particular study. So based on this study and some of the other studies also show that they should be having consensus between a ENT surgeon and the speech language pathologist. So that will give a betterment for the voice production of the patient. Another study, whereas they have done the similar kind of thing, but the therapy method was different. It was confidential voice therapy, resonance voice therapy, and one group was not taking any kind of therapy. And from this particular study, they have seen that they could get the improvement within 2 weeks of therapy. So this is one kind of therapy like resonance voice therapy. It is one of the kind of therapy which gives betterment for hyperfunctional voice disorders, especially with respect to professional voice users. And similar to resonance voice therapy, other one kind of another one it is LMRVT. This is a modified form of resonance voice therapy and the vocal hygiene comparison. And from there also they could get a improvement with respect to VHI. Along with that, VFE, that is vocal function exercise, this also having a good evidence-based practice. People have reported of having good improvement after taking vocal function exercise, and it is not required to have many sessions. Like they can go 56 sessions, and with that they could get a significant improvement. So work in acoustic analysis and perceptual analysis. So similar to that, another study I want to show it here. Omeprazole with voice therapy they have given, and one is with another group with omeprazole with placebo. So from here they could get that whenever you are taking medicine, along with that medicine, you should go for voice therapy. That is what showing good improvement than only taking medicine. And here, another study I want to give an information regarding intensive voice therapy and standard voice therapy. When they compare these two intensive and standard voice therapy with respect to the number of sessions, so here you can see both of them were taken 8 sessions only. But in the case of intensive voice therapy, they have taken 4 sessions in a week. So another standard voice therapy is 1 in a week. In both cases, there was no significant difference. Statistical significant difference was not there. Both cases, pre and post comparison, there was improvement. So what I want to tell from this is that even if you are taking a standard voice therapy, also you will get a good improvement. So if a professional voice user won't be able to come for a regular therapy like 4 days in a week, then also, even if you are taking 1 session in a week, it itself get a good improvement for these people. So another one point I want to highlight here is that some of the common abusive non-vocal habit, you can see in professional voice users. As you can see here, these are some of the professional voice users present in our country as singers, politicians, teachers, and vendors. So most of them consumption of tea and coffee, more than 3 to 5 cups of 100 ml in a day. It is more than 50% in most of these professional voice users. As you can see here, in the case of politician, it is more than 80%. So it is a very high in the case of politician that can increase their voice problems. So along with consumption of tea and coffee, consumption of alcohol, smoking, and preference of for carbonated soft drink like a Coca-Cola or Pepsi or any soda related drinks. So all these factors are more in this professional voice user. That also one of the reason, along with this hyperfunctional voice, this can leads to their voice related issues. It's the professional voice users are one of the kind of people where they are very easy to get vocal nodule and so we need to give an awareness to this particular population regarding all those problems, so we can make sure that they are using their voice for their profession in a better way. So along with that, the duration, even if they are getting voice problem, they won't be coming immediately to us. Even in the case of ENT or NSLP, they won't come immediately to us. They'll take their own happy time. After that, only they'll come to us. So studies showing that more than a week they'll take to consult any professional. In the case, so you can see most of them take more than a week time to consult any professional, even they having a voice problem. So with the voice problem, they continue using their voice, that will increase the severity of voice problem. And along with that, uh, they are not taking any professional help. With that, they use their own preventive mechanisms, like they start drinking warm water or voice rest. These are the good method. Few of them will take that. Some of them go for other traditional practice, like consuming milk with pepper and ginger or turmeric, or some of them will take honey and the salt water gargling. These methods, they what they do instead of going to our professions. So that also comparatively will affect their voice if they are not whenever they are getting problem, if they are not going to the professional and they are waiting for a longer period, that can lead to severity, that will increase the severity of the problem. So my another point here is that whenever you see a population professional voice user, you have to identify these points as you have put it here. You can ask about their vocal hygiene. Are they aware about vocal hygiene? Are they following any of the vocal hygiene? If they are not aware about vocal hygiene, you have to explain to them to continue to use their voice in a better way, then only they can continue in their profession. And regarding their throat clearing, also you need to be asked, like how frequently they are clearing their throat. So whenever they're having some kind of growth in the throat, they may think that something sitting there. They try to clear the throat. So that is also an indication they have some kind of growth happening in the vocal cords as such. And the what kind of yelling or screaming they are doing. If it is like a teachers, how well they are using their voice, how frequently they are screaming to children. So what kind of teacher they are they with respect to any preschool teaching any preschool kids, or are they dealing with higher standard students? If they are dealing with preschool students, of course they will be screaming frequently than the other group. So all those things are matters. So whenever you are taking a case history, we have to know all these factors. According to that, we need to counsel them, and it is mandatory to have a public awareness program where they have to we have to explain to teachers or in these kind of politicians, singers, or even actors in that case. So we have to explain to them, we have to create awareness and telling them these are the possibilities, these are the problem what you are making to your voice. So if you are taking care, you drink water properly, you reduce the intake of caffeine. So by using all this vocal hygiene, you can have your voice for a prolonged period of time. Otherwise, what will happen? After some time, you will lose your voice. Your good voice will you lose. So after that, you won't be able to continue with your profession. So that need to be explained to them. Need to create a public awareness that is mandatory from a profession like a speech language pathologist as such. So that is what I want to tell. I'm concluding here. That's all I want. That's all, ma'am. So if you're having any doubts, because I'm entirely different from your profession, if you're having any doubts, you can ask me. And I would like to thank Dr. Kavita Sachdeva, ma'am, to give me an opportunity to present. And NSCP always a good memory for me. I was there for 3 years. So I've learned so much from there also. So thank you, ma'am. And I would like to thank my director, Dr. Pushpavati, also. If there is any doubts, you can ask me.
Thank you, Irfana, for a wonderful insight into the speech therapy aspect of vocal nodules. And
Thank you.
I'm very thankful that you joined in spite of a delayed schedule. And thank you, Dr. Sriharsha, for being constantly with us for past 2 to 3 days. I
Thank
hope
you.
we'll continue having this.
Sure.
Thank you, my team of ENT department.